a short video on non-invasive studies for arterial circulation. I'll touch on venous circulation at a later date. This is really just for people in the medical profession, medical students, surgical residents who sometimes don't need a little bit of help in understanding what these tests are and what they stand for. So ankle brachial index, ABIs, that's a measure of how much blood flow is getting down there. So is it an anatomical test or a physiological test? Well, it can be both, but really it's more of a physiological test. Why? Because you're measuring pressures. So an ankle brachial index is the pressure at your ankle versus divided by the pressure at your arm, and that number should be 1 or greater. And there's caveats to all this stuff, obviously, but just for general learning purposes, ankle brachial index should be 1 in a normal test. And so how does this test being done? Well, there's 2 sites you can take an ankle pressure. One's on top of your foot, dorsalis pedis pulse. The other one's at the side of your foot, your posterior pulse. So blood pressure cuffs applied to the ankle area and then maximally inflated and then deflated, and just like a regular blood pressure, where that pulse comes in, that's your systolic dorsalis pedis pressure and then your posterior pressure. Similarly, it's taken in the arms, and you take the systolic pressure, and so the ankle brachial index is the systolic pressure in the ankle versus divided by the systolic pressure in the arm. But which pressure do you use? So I see this a lot, even with the vascular technologists sometimes. They'll say an ankle brachial index is abnormal because one of the pressures at the ankle is lower than the other one. So for example, the dorsalis pedis pressure is 93 millimeters of mercury pressure. The posterior tibial pressure is 130 millimeters of pressure, mercury pressure, and then the arm pressure is 120. Well, that's actually a normal ankle brachial index because it's the highest pressure at the ankle divided by the highest pressure on either arm. So ankle brachial index is the highest pressure on left ankle brachial index is the highest pressure at the ankle, DP or PT, doesn't matter, divided by the highest pressure in the arm. Similarly, on the right side, the highest pressure at the ankle versus the highest pressure at the arm. So generally speaking, it should be greater than 1 or greater. Anything less than 1 is a little bit abnormal. I mean, it depends on your lab, but essentially, if you're less than 1, then depending on the level, then you start to worry more. So, and then toe pressures are a separate entity that are part of the ankle brachial index, an important part of it, which we'll talk about. But so if anywhere between 1 and 0.8, then you can be asymptomatic, i.e. have no symptoms, or have intermittent claudication where you have tighten up in your calf muscle when you walk. If it's much less than 0.8, then you start worrying about wound healing issues. At 0.4, so there's an important thing to know. If your ankle brachial index is 0.4, you have a very high cardiac risk, so very high risk for death from cardiac disease. It's an important number to know. So if you see somebody with an ABI of 0.4, be really concerned about their cardiac risks and their mortality. But then the toe pressures are important too, especially in diabetics that might have calcified vessels. And so the ankle brachial index may be falsely elevated, meaning that it's hard to compress a calcified vessel. So your ankle brachial index will be a ridiculous number, like 5, 6 or something, or 2. So that's abnormal. So that's where the toe pressure really adds a lot, because the toe pressure gives a better measurement of the perfusion distally, because that's where the wounds end up, right, in the feet and the toes. So the toe pressure, anything over the number I was taught as a fellow in general surgery training was 40. Anything over 40, you have a fair chance of healing. 60, 70, really good chance of healing. But much less than 40, then you got to worry about difficulty with wound healing. And so ankle brachial index, again, 0.1 or greater. Anything below is abnormal. Toe pressures really gives us a better measure of perfusion to the foot, to the ability to heal wounds. There's other people doing TCO2s and all that stuff, which I won't really get into because that's not done in a lot of different labs. PVRs I won't really kind of get into. This is just kind of a cursory background on ankle brachial indices. Arterial duplex is different. Arterial duplex is a complementary test to an ankle brachial index. So it's more of an anatomical test. The way I think about it, it's actually the imaging of a vessel. So, vessels waveform should be normally triphasic. Biphasic signals are abnormal, and monophasic signals are definitely abnormal. So essentially, you trace the vessel from the femoral artery all the way down, and you document if it's a biphasic, triphasic, or monophasic, and then you look at the plaque with the imaging, and you see with the grayscale imaging, that's without color, grayscale, you can see plaque formation. You put in color flow, and you see whether it's elevation of velocities and turbulent flow, and so that gives you more of, I think, in my mind, the way I put it together is the duplex is more of an anatomical, here's the lesion kind of issue, and then the ankle brachial index tells you, the distal perfusion is poor. Physiologically, it's not really good enough. My when I was a chief resident at Minnesota, Dr. Chute, who's my vascular surgery staff guy at that time, who I really remember fondly, he used to say, if you have an ankle pressure less than 80, then think about worry about difficulty with wound healing. But that's in a nutshell ankle brachial indices and arterial duplex. Just so that you have better background in terms of when to order these tests and what they mean, and you can interpret them better.